Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of internal medicine is the hepatocellular carcinoma. We will discuss this topic in 5 sections. In the first section, we will talk about the etiology of hepatocellular carcinoma. What are the different causes of hepatocellular carcinoma, how it presents, what are the clinical features, and also the physical signs and paraneoplastic syndromes of the hepatocellular carcinoma. Then in the second section, we will discuss the staging and classification of the hepatocellular carcinoma and how we approach to the patient with hepatocellular carcinoma. Then in the third section, we will discuss the different diagnostic steps for the hepatocellular carcinoma, and then also the screening and the preventive methods for the prevention of hepatocellular carcinoma. In the fourth section, we will discuss the stage 1 and 2 treatment of hepatocellular carcinoma. All the cancers and carcinomas are divided into different stages depending on the histological pictures and the clinical signs and symptoms. So stage 1 and 2 treatment, and then in the fifth section we will talk about the treatment options for the stage 3 and 4, which will be some drug inhibitors used for stage 3 and 4, and then the novel medical treatment strategies, evaluation of non-surgical responses of the patient with the hepatocellular carcinoma. So all this will be covered in our today's lecture, which is hepatocellular carcinoma. Keep watching sqadia.com to learn about this topic.